When should one repeat 4th-generation HIV test post-exposure? Sarah, not real name, took a 4th-generation HIV test, which can detect both HIV antibodies and antigens. She tested negative at 30 days and was overjoyed, believing she was HIV negative. However, her joy was short-lived as she later tested positive after the HIV window period, i.e. after 45 days, revealing that she was actually HIV positive. This scenario highlights the importance of understanding the window period and the need for retesting after the window period to confirm HIV status. Did you hear that? Alright. Before I tackle this entire video, here is a highlight of what this video will answer just to help our viewers on Mark Medical's channel. 1. What is a 4th-generation HIV test? 2. What is another name for a 4th-generation HIV test? 3. What is the most accurate type of HIV test available? 4. What is the accuracy of 4th-generation HIV tests? 5. What is the recommended time for a 4th-generation HIV test? 6. What is the recommended time to repeat a 4th-generation HIV test? 7. What is the need for confirmatory testing in HIV diagnosis? 8. What are the different types of HIV tests available? 10. What should you do if you are concerned about recent HIV exposure? Or when to take PEP for HIV prevention? Ready? Alright. What is a 4th-generation HIV test kit? A 4th-generation HIV test is a laboratory test that can detect both HIV antibodies and p24 antigen, which is associated with HIV. HIV antibodies are proteins produced by the human body in response to HIV infection, while p24 antigens are structural proteins that make up most of the HIV viral core. High levels of p24 are present in the blood serum of newly infected individuals during the short period between HIV infection and before they fade away. What is another name for a 4th-generation HIV test? A 4th-generation HIV test is also called an enzyme-linked immunosorbent assay, ELISA, test. The test requires a blood sample that is sent to a lab for testing, and it is the most accurate type of test. The 4th-generation test is more advanced than antibody-only rapid tests and can detect HIV sooner than the antibody rapid tests. The optimal time for testing is at least 6 weeks after suspected exposure to the virus, and the test is typically conducted 45 days onwards after potential HIV exposure for a conclusive result. The test is extremely accurate, with sensitivities and specificities above 99.7% for established infection. If the test result is positive, it is routinely confirmed using a different type of test like HIV RNA testing kits. What is the most accurate type of HIV test available? In my own view, HIV RNA testing kits are the most accurate because they detect the actual HIV viral proteins, and in addition, they have the shortest window period of just 10 days. Results from an HIV RNA test are conclusive just after 33 days. The 4th-generation HIV tests are also highly accurate, with sensitivities and specificities above 99.7% if you have been living with HIV for some time. These tests are reliable and can detect both HIV antibodies and the p24 antigen, which is associated with HIV. The accuracy of the tests depends on when they are conducted, as testing too early may not detect the presence of the virus. It's important to wait until after the window period to avoid false negatives. For those of you who are new to this channel, the window period is the time immediately after infection, during which tests cannot always detect antibodies or p24 antigen. 4th-generation tests will pick up 99% of infections at 6 weeks, and after the 3-month window, they are more than 99.97% accurate. As I already said, the 4th-generation test is typically conducted 45 days onwards after potential HIV exposure. If there is a concern about a recent exposure that happened less than 72 hours ago, it is essential to seek consultation for post-exposure prophylaxis or PEP as soon as possible. Additionally, the HIV-1 RNA-PCR test can provide accurate and reliable results at 10 days after exposure. What is the need for confirmatory testing in HIV diagnosis? Here is one example from my experience as an HIV physician. John, trusting his doctor's initial HIV diagnosis, began medication without a confirmatory test. Later, a second test revealed a false positive, highlighting the importance of comprehensive diagnostics before commencing lifelong treatments. This example exactly shows that the need for confirmatory testing is essential. A positive fourth-generation HIV test result is routinely confirmed using a different type of test called Western blot or any HIV RNA tests as seen in developed countries. This additional test helps to ensure the accuracy of the result. While the fourth-generation test is highly reliable, a reactive result must be verified to rule out the possibility of a false positive. Confirmatory testing provides an extra layer of assurance and is a standard practice in HIV diagnosis. It's important to follow through with the recommended confirmatory tests to obtain a definitive diagnosis and, if necessary, initiate appropriate care and treatment. What should you do if you are concerned about a recent HIV exposure? Here is another example of one client I still remember. John, alarmed after unprotected intercourse with a later confirmed HIV-positive partner, sought my guidance. Prescribing PEP, I closely monitored him. After 30, 45, and 90 days, John tested HIV negative, highlighting PEP's effectiveness when administered promptly post-exposure. This implies that seeking medical advice is crucial, especially if you are concerned about a recent exposure. If the exposure occurred less than 72 hours ago, it is essential to book a consultation or contact the NHS as soon as possible. In such cases, you may be eligible for PEP, post-exposure prophylaxis, for HIV following an adequate assessment. However, PEP needs to be initiated within 72 hours of exposure to be effective. It's important to act swiftly and seek medical attention to discuss the potential need for PEP and to ensure that you receive the most appropriate care and support. Early intervention and access to PEP can significantly reduce the risk of HIV transmission and are an important part of post-exposure care. What is the accuracy of fourth-generation HIV tests? The fourth-generation HIV test is a highly recommended test that can detect HIV as early as 14 days following transmission. It is a combination test that looks for both HIV antibodies and the protein 24 antigen, allowing for earlier detection of HIV after exposure. This test is more reliable and has benefits over older antibody tests, as it can identify acute HIV infection sooner than previous tests, reducing the window period for detection. Testing too early, for example, after 4 weeks, may only detect 95% of infections. The fourth-generation test, however, has improved benefits over earlier generation tests because of its ability to detect HIV earlier, which has important treatment implications. What I need to remind you of is that false positive results are possible, so a reactive result must be verified with confirmatory tests. However, the fourth-generation test has a much lower chance of a false positive compared to older tests. What is the recommended time for a fourth-generation HIV test? The fourth-generation HIV test is a highly recommended test that can detect HIV as early as 14 days following transmission. It is a combination test that looks for both HIV antibodies and the P24 antigen, allowing for earlier detection of HIV after exposure. Testing too early, for example, after 30, may only detect 95% of infections, meaning the test is not conclusive at 4 weeks. The test needs to be done after the window period to avoid false negatives. The fourth-generation test can detect P24 within 1 month of exposure, though at this time your test results will not be conclusive. What is the recommended time to repeat a fourth-generation HIV test? The recommended time to repeat the fourth-generation HIV test is after 3 months from the exposure. This is because the test needs to be done after the window period to avoid false negatives. This is because HIV antibodies by the end of 3 months will be sufficient enough to be detected by the test kit. What are the different types of HIV tests available? The availability of other types of HIV tests is important to understand. In addition to the fourth-generation HIV test, there are other types of HIV tests, such as rapid or antibody-only tests, and HIV RNA tests like a PCR. These tests have different test window periods and use different ways to detect HIV. For instance, the fourth-generation test can detect both HIV antibodies and P24 antigens, allowing for earlier detection of HIV after exposure. On the other hand, HIV RNA tests can detect the actual virus in the blood and are recommended for people who have had a recent or possible exposure to HIV. It's essential to discuss with your healthcare provider to determine the most suitable test based on your specific situation and potential exposure.